was that we knew that stuff was going to happen because we'd actually seen it happen before, and we knew we needed to be ready for it. And so we got prepared, because the main thing that we were worried about, the biggest tool our opponents have in their toolbox to divide up our solidarity and keep us from coming together and keeping that balance of power is their divide and conquer strategies. When they make us fight together with other people in the 99%, the other people who are a little less poor, the people who are lazy, the people who are on public assistance, whatever, but they divide us with that. And one of the main tools that they use to divide us is by cracking us along the fault lines that already exist with racism and sexism and patriarchy and all these other systems of oppression that exist in our society. So when we kicked off the Healthcare as a Human Rights campaign in 2008, the first thing we did was we started out with anti-racism trainings. We did 8 trainings, put up 175 people around the state, members of our organization, through these 8-hour-long anti-racism trainings, actually practicing having conversations about what was going to happen when legislators tried to divide us against undocumented workers who are in our state, working on their dairy farm, where we said that we wanted to have a distributed our healthcare system, and our legislators were going to try to divide people along the issue. So we practiced having those conversations about how we need everyone and how it has to be equitable for everybody. Everybody in, nobody out. Otherwise, that's not a human right, and the human rights framework came in really handy, because when we talk about human rights, it's pretty simple. You're a human or you're not a human. And if you're a human, then you have a right to health care. And it happened. So at the end of, actually the 11th hour, the bill had passed the House. It was in the Senate. They were literally about to vote it past. This was a bill passed legislative session out of the Senate. And last minute, 2 senators, a Democrat and a Republican, co-sponsored an amendment to exclude undocumented workers from our health care system. And a huge majority, I think it was like something like 8 out of 40 voted against the amendment to include it, but the majority of people, Democrats, Republicans, and even the Progressive Party in Vermont, voted in favor of excluding undocumented workers. But I don't think they knew how prepared we were for that, and we actually reacted, and because our members had practiced having these conversations, because they were grounded in these human rights principles, instead of being divided like our opponents wanted, we were even stronger, built stronger alliances with other organizations, including the Vermont Migrant Farm Workers Solidarity Project, teamed up, had hundreds of people call their legislators, turned out dozens of people to the State House, be there till 8 o'clock that night on the last day of the legislative session until they took that amendment out of the bill.
This working group, like many for the Occupy Wall Street, this Healthcare for the 99% working group meeting is occurring at 60 Wall Street, also known as The Atrium, just down the block from the stock exchange, literally catty corner a block and a half block away, in a public space. We have 1 hour healthcare for the 99% working group here, and right next door we have another working group having their planning meeting and working group meeting.
And then we're going to divide these